Dr. Pihlblad, welcome and good to see you.
Yeah, good to see you. Thanks for having me.
Yeah, I haven't seen you in a while, and I'm sorry that we have to do it over Zoom like this, but I've always enjoyed your work and everything you do, and I want to get into that a little bit. But I'd also like people to know a little bit about about you and sort of what got you to where you are. Uh, all of our faculty, yourself included, have an amazing amount of education and experience that got you to where you were, to the position that you're in, and doing clinical research and other things that you do. So it's always impressive, but I'm always intrigued as well to hear the story behind that. Like, what are the things in as you're going through your education training that made you decide I want to focus on ophthalmology and particularly pediatric ophthalmology? Tell us what drove that interest.
Yeah, so growing up, my mother was a teacher. Three of my brothers are teachers. My grandfather was a professor. So growing up, I always thought I'd be in some form of educational field. And so in undergrad, I went to Washington and Jefferson College, it's local, and was a biochemistry major. So I was drawn to the sciences and trying to figure out what to do, thinking educational wise that medicine and then medical education specifically was an interest of mine. And so working at an academic institute like UPMC, where we have lots of residents and fellows, medical students to teach, was kind of my career path and where I'm at now, but was kind of established younger when I was thinking education would be something I wanted to be involved with.
Well, and it's interesting. You do research in your clinical work as well, along with your clinical work, which is a rare combination and something that certainly we, not so rare for UPMC or the medical area, but we still have, this requires a lot of time, and you focus on a condition called strabismus. As a matter of fact, when I first met you was when you were getting a reward from an award from the Knights Templar Eye Foundation, and but strabismus is one of those conditions maybe a lot of people don't know a whole lot about, and it's also one of those things as far as research that I know a lot more needs to be done. So tell us a little bit about some of the things you're working on there related to your clinical science.
Yeah, so just basically strabismus means a misalignment of the eyes. So about 4% of the population has strabismus. So your eyes can cross or they can wander. One could be higher than the other. This can be a condition that affects pediatric patients, which is the majority of what I see. Can also affect adult patients. So adult patients can have eye misalignment. It can be an issue that they've had since they were a child, or it can be something new. So if they've had a stroke or a brain tumor or bad head trauma, those can all induce strabismus, eye misalignment, and double vision. And so that's my biggest area of focus, and the most common surgery I perform is to correct eye misalignment. And so a lot of my research is involved in that. The way we do eye muscle surgery is we either tighten or loosen muscles to try to realign the eyes. The way we do that eye muscle surgery hasn't changed much in the last several decades. The principles that we do are the same as they've been doing for a long, long time. So a lot of the research I'm doing now is trying to come up with new innovative ways to do that surgery and use new technology to help enhance that. So that one award I got was using advanced new OCT technology to try to improve the eye muscle surgery and the way we teach how to perform that surgery as well.
So trying to visualize the muscle a little bit better so you can see how much you've impacted the through your surgery, the change. Is that how the OCT helps you with that?
Yeah, so you can use the OCT potentially before the surgery to try to find where the muscles are located. Your eye muscles are not far they come from behind the eye and come forward, but they're right there, but you can't really see them with your naked eye. So the OCT lets us visualize the muscles potentially before surgery. At Children's, we have a brand new OCT microscope. So during surgery, we can actually visualize the muscles before we start the surgery. And then during surgery, we can visualize the surgery we're performing and how deep our suture passes are to make sure we're not too deep. And we can also use it post-operatively to make sure the muscle stays where it's supposed to be. So, UPMC usually has all the advanced latest technology, which we have. And so the new operating microscope that we have is very helpful in performing the surgery, and then also with resident and fellow education, teaching them how to perform the surgery.
It's got to be very technical, I imagine. I mean, you're looking at very small muscles, particularly in kids, right? That you're doing that with. Obviously, training is very, very important. Now, so you take part in training a lot of our residents as well. That's a big factor in what you do in your everyday work life.
Yeah, so the residents, they rotate through all the services, pediatrics included. So we have 1 to 2 residents on our service at a time. We have 1 to 2 fellows in pediatric ophthalmology and strabismus each year. And so we're having them rotate through clinics and surgery. And so we're educating them daily.
That's really great. And, you're young, you're early in your career, I should say. But you're doing all these really cool things. And I imagine that working with pediatric patients, it's got to be very rewarding. And particularly these, I've certainly known people with strabismus and family members and so forth have had that condition, and how rewarding it is to be able to repair that for people. So tell us something that you'd identify as an outcome or something that you were really proud of.
So recently, there was the World Society of Pediatric Ophthalmology Worldwide Connect. So it was an international conference, and one of my former fellows that we trained a couple years ago won the Best Video Award for the strabismus technique that I taught him. So cool. It was an innovative technique. He presented a video on how to perform it. So, my former fellow, out giving international talks and winning awards based on what I taught him was maybe one of the my proud moments so far in my career.
Oh, that's excellent. Yeah, that's really excellent. And those are proud moments in academic medicine for sure when we see that. But to have that happen already, that's really, really cool. So you came. I know it's just been. How long have you been? I hate to guess. It's been about 6 years or so that you've been.
Yeah, five going on 6, I think. Yeah.
It goes very quickly, but
yeah.
And since you've come, there's already been some changes, in leadership here within the organization, and we've really grown a lot. And this certainly, as you said, it's a very stimulating academic environment. What are the things that you can see being an advantage to you moving forward that really can make some of the work that you're trying to do, either in research or clinically, benefit from all that we have going on in terms of this, the department right now?
Sure. So University of Pittsburgh and UPMC, we're always at the cutting edge of new technology. That new OCT microscope, I do not think many children's hospitals in the country have that available for them to use. And so, that along with many other things, keeping at the cutting edge of technology, can keep my research, clinical research and teaching kind of up to speed and at the cutting edge.
Uh-huh. And you're getting a chance to work with some pretty big names in the field, both Ken DeShal, pediatric ophthalmology, and Jose Sahel, and the chairman of ophthalmology. Have you you seen this as an opportunity as well for in terms of your trajectory and where you'd like to go, and how this will kind of set the stage for some good things in the future?
For sure. So yeah, I mean, what drew me to Pittsburgh and the hospital, Dr. Nish was here, well-known, world-renowned pediatric ophthalmologist. So his leadership and expertise is the big reason that brought me to Pittsburgh in the first place. And Dr. Stayhill and all his clinical research and clinical trials and expertise in the new institute that we're building are all, great leaders in the field that are, making things very exciting around here.
Well, I think obviously we all agree on that. And I think that in the future, particularly with some of the things that people want to do clinically in academia, the sky's the limit. So what are some of the goals that you would look at in terms of what you're trying to do, either in research or even just clinically? That where do you think that where can we be in another 5 or 10 years with some of the things that you're doing now that may be improved because of some of the work that we're doing here in Pittsburgh or in general?
Yeah, so as I kind of was mentioning earlier, strabismus is a very common condition, and the surgery we do is not dramatically different than we did a long time ago. So, and our outcomes are not as high as we want them to be. So having a second strabismus surgery is not that uncommon of a problem. So trying to get better at the surgery we do, analyze our outcomes, use new technology to try to improve all these things. Hopefully down the road we can improve our outcomes of our strabismus surgery, make it more safe, with this OCT technology, to make sure we're not having complications or issues with it, and then just having better outcomes, less reoperations, and more successful clinical outcomes.
Well, I mean that all sounds like very exciting, but also really good news for patients in the future. So thank you for doing everything you do, but also thank you for spending some time here today and giving us a chance to get to know what you're doing a little bit better, but also get to know you a little bit better. All right, have a great day.
All right, you too.